Okay, now in terms of how to make the vaccine, there's broadly two components. One is either the lymphoma itself from any particular patient or some component of the lymphoma. The piece of lymphoma used for the vaccine is then combined with something else called an adjuvant. And the main point of the adjuvant is to inflame the immune system and to tell the immune system that the object that's been given with the adjuvant is potentially dangerous. The problem with lymphoma and other kinds of cancer is that the body doesn't automatically recognize it as a danger and is happily coexisting with it. So the point of the vaccine is to make the body recognize the lymphoma as a danger and therefore to try and get rid of it. So when you're making a cancer vaccine, you obtain something from the cancer, add to it the adjuvant which makes the immune system able to target the lymphoma. The adjuvant can either be a chemical adjuvant, as is used in most of the vaccines for viruses, for example, or it can be what's called a cell-based adjuvant. The most popular cell-based adjuvant is called the dendritic cells. Dendritic cells are in the body, and if you administer any vaccine, the dendritic cells that are already in the body have the potential to capture the vaccine and to produce the immune response that leads to the cancer control. For a range of reasons, many people believe that the most powerful way of delivering a lymphoma vaccine is in combination with the dendritic cells, which have been mixed with the lymphoma out of the body. A lot of research has evaluated whether you can inject the lymphoma or components of the lymphoma with chemical adjuvants. Other research has looked at and continues to look at using the dendritic cells from the bloodstream of the patients as the immune booster. And that's what we are doing in this particular case. In order to use the lymphoma tissue can be collected either at diagnosis or at any other time during the course of treatment of the particular patient. The dendritic cells, if there is a dendritic cell vaccine being made, are generally harvested from the blood of the patient using a leukapheresis machine, which is essentially the same procedure as is done for collecting stem cells, but the patient doesn't require any treatment before the harvesting of the dendritic cells. So they come in the morning, essentially off the street. They haven't required chemotherapy, haven't had growth factors. They go on the machine and the blood cells are harvested. Once the blood cells are harvested, there are a number of procedures undertaken in the laboratory which purify the dendritic cells that were mixed with other cells in the blood and to make them more powerful at stimulating the immune system. Once we've made the vaccine, in which we have combined the patient's own dendritic cells with their own lymphoma, the vaccines can be stored in portions that allow us to give multiple vaccines over a period of many years. The number of vaccines that we make depend to an extent on how many dendritic cells are in the blood of a particular person and how much lymphoma was available for the making of the vaccine. But in many cases we can make vaccines that would be suitable for treatment for 1 and in some cases 2 years. The vaccines are stored using various chemicals that allow the vaccines to remain alive and are stored in liquid nitrogen. And that storage can continue essentially indefinitely, but probably for at least 5 or 10 years. When the vaccines are administered, the vaccine has to be taken out of the liquid nitrogen, thawed to body temperature, and then administered almost immediately after the thawing process.